Hello, this is Dr. Brandt Gibson, and the idea is when you're testing for peripheral neuropathy, one of the other tests that we will commonly do is a vascular test. And you're saying, okay, why would you do a circulation or vascular test for neuropathy? Well, one of the initial theories of why peripheral neuropathy was happening was that the vessels flowing to the nerves were not sufficient. You were not getting sufficient blood flow to the nerves, and the nerves were dying due to a lack of nutrients, lack of the necessary proteins and necessary vitamins and minerals and so forth for life. And so if you don't get blood flow, you don't get the improvement that you're expecting. Easiest way to describe this. So if you were to have a garden and you had a furrow between the rows of where the water was flowing, if you interrupt that flow, the plants down lying from where the flow is not going anymore will die because they don't get sufficient water. They don't get the nutrients they need to continue to grow. Same thing happens for nerves. If you don't get the blood flow to the nerve, you can actually have a problem. So we actually do a vascular test to evaluate the blood flow to the lower extremities, especially to say, okay, are we getting sufficient blood flow? Because if you can improve blood flow, a lot of times the peripheral neuropathy symptoms will improve as well. So you could actually have a vascular component to your peripheral neuropathy. So check for blood flow, check to make sure the blood flow is sufficient. One way that we do that is by checking pulses. We check the Dorsalis Pedis, which is on the top of the foot. We check the posterior tibia, which is at the medial ankle area, or the inside of the ankle area, just behind the bone of the ankle, the medial malleolus. And you can actually check in both cases to see how the blood flow is going. You can do capillary fill time where you touch the digit and the blood flow comes back to it. So it goes white and then it goes pink really quickly. That's consistent with, again, with a good capillary fill to that area. You can also do a non-invasive vascular testing through blood pressure cuffs on different areas of the upper and lower extremity, and you evaluate it. You can do the ABI, ankle brachial index, where you check the pulses, or check the pressures that can stop the pulses in the upper extremity compared to the lower extremity. So you're basically checking to determine if you're having the same amount of flow to the feet that you get to the hands. And what that tells you is if you have any decrease in blood flow, but it can also tell you if you get calcification of the blood vessels, like we sometimes get in diabetics, where it can say, okay, this is also a problem because you're not getting the expansion and contraction of the blood vessel like you're supposed to have. So I do recommend, if you have peripheral neuropathy, that you get a vascular test to determine if you have sufficient blood flow to the upper and lower extremity. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 75.